Hi, I'm Dr. Kristin Kirkby Shaw, and today we're talking about canine osteoarthritis. Osteoarthritis is the #1 cause of chronic pain in dogs and estimated to affect at least 1 out of 5 dogs. It's a condition that starts developing actually in young dogs, often within the first year of their life. And then it starts to progress as they get older. That's because it's almost always secondary to a genetic or developmental condition such as elbow dysplasia or hip dysplasia. While any breed of dog can develop arthritis, there are certain breeds that have a greater risk, including Golden Retrievers, Labradors, and German Shepherds. Finally, one of the biggest risk factors for developing arthritis is if your dog is overweight. The things that you're going to look for to know if your dog has arthritis is if they're young, they may show signs of limping or just an abnormal gait, especially after activity or exercise. As they age, the symptoms tend to wax and wane and may be confused with general signs of aging. So what you'll want to look for is your dog just slowing down or not wanting to do the things they used to want to do, like go for walks, having difficulty jumping in and out of the car, or just not getting up to greet you when you come home.
And I'm Meredith Kahn, and I want to talk to you about what you can do. So early intervention here is really key. Make sure to talk to your veterinarian about implementing certain lifestyle changes like dietary management for weight loss and the prescription of drugs like Adequan Canine, also known as polysulfated glycosaminoglycan. Adequan Canine is the only FDA-approved injectable disease-modifying osteoarthritis drug for dogs, and it's proven to actually proactively treat the disease state and not just signs and symptoms of osteoarthritis, which really differentiates it from other options out there like supplements and non-steroidal anti-inflammatories.
Meredith is exactly right, and the one other thing I would add is that it's a misconception that dogs with arthritis shouldn't be active. In fact, we know that they should have regular, low-impact activity, such as going for a walk every single day.
Remember that Adequan Canine is a prescription drug, so only your veterinarian can decide if it's the right choice for your dog. If your veterinarian chooses to go ahead and prescribe Adequan Canine, make sure to discuss any possible side effects, such as hypersensitivity to the active ingredient of Adequan Canine. Adequan Canine should never be used in dogs with a known or suspected bleeding disorder, and it should be used with caution in dogs with a renal or hepatic impairment.
If you're looking to learn more about arthritis in general, to know a little bit more about the signs and symptoms, and all of the treatment options available, you can visit caninearthritis.org.
You can also visit adequancanine.com, or you can call 1-800-458-0163, where you can request a full copy of Adequan Canine's prescribing information.